I'm saying, so people who, and then you got to think about the people who die when they do get COVID, who dies. Well, it tends to be the same stereotypes, right? Yeah, definitely obese, but renal failure, diabetics, over the age of 65. So let's put the numbers together. 330 million people in America, according to the CDC, 800,000 deaths,
Okay.
right? You can do the math on that. That's really not a large amount for me to keep calling it a pandemic and for jobs and stuff to shut down. It is large enough for us to pay attention and go after it, definitely. But out of those 800,000, let's see. The ones who are dying, 80% of those are obese, over 65, diabetic, renal disease, and really essentially the same people who would die from any massive inflammatory insult to their body. The flu could do it. A lot of the COVID deaths we have, how do you know it's COVID? When people get COVID, do you check them for echovirus, adenovirus, which is much more common than any other virus? Do you check them for influenza virus? No, we check them. We say, oh, you have COVID, and there's a virus, and you're sick, so it must be COVID. Really, really? That's our level of medicine now. That's kind of not true. Unless you can exclude everything else, you can't really say it's, that's number one. Number two, we're relying on a test that up until what, June 2020, I mean, we didn't even really trust. Even today, we still don't trust. We're screening people. People are coming up saying, oh, I want to take this test to see if I have COVID so I can go back to work. Well, guess what? If you feel fine, whether you have COVID or not, the test is likely to miss 20% of the people. So what are we talking about? What test are you talking about? Gatlin and I were talking. If you have a test, right? We talk about sensitivity and specificity, right? Sensitivity is, and slow me down if you want to jump in.
Okay.
Sensitivity about a test is the test is so good actually. It captures so much that it can sense anything. So if you have it, even if you think about getting it, then yeah, it has high sensitivity. But if it's sensitivity, that means it catches everything. Then if it catches everything, that it's not always as specific, right, to the drug. I mean, to what we're looking for. So sensitivity and specificity are good. You want something that's highly sensitive and something that's highly specific. Meaning, I want you to catch it, and I want to make sure what you're catching is specifically what I'm looking for. Well, if you're very sensitive, you drop specificity. If you get really, really specific, you're so specific that you can miss a mutant or something like that, right? So we're looking for tests, and we're going in and we're relying so much on these tests that may or may not even make sense. How are we diagnosing so much COVID?
Okay.
So these tests is like
Are the numbers real?
I seem like I just took these. Well, just thinking about this, how many tests I've taken since over this past week. Like 2 or 3.
Tell your story about the test, Harry. How many did you take?
I take about 3 tests. First test,
and the one negative. You took when you were sick said what? Was it positive or negative?
It said it was negative.
Merry Christmas.
And then when I went to the hospital with the rest of the kids and the fam. Now it's positive. Like. So waiting on the next thing that the final results from. It said they had to wait for a few days, so that's finally coming back, and now it's saying positive. So but I mean, when I took the quick one, when people was in line taking these tests at these little different makeshift, test things so people can check themselves. And I said that the rapid, if you did the rapid one, they was already telling me that it was only probably going to be 30% accurate.
So why do you think they use a test that's only 30% accurate? Why would they waste their time?
I have no idea. I mean, I don't understand. I mean, this whole thing is just really, it really makes me question everything now. Second guessing it, like,
Yep. Well, so to answer it quickly, is back to that sensitivity, specificity stuff, right? It's like if you do have it should pick it up. Is it always right? No. So what they're saying is that if it didn't pick up, then you should go ahead and get another test to prove that what wasn't there in the first place really is there, even if it's not there, because even the follow-up test isn't really 100% accurate. So you see how convoluted this gets, right?
Right.
You know, so, but anyway, you know, which is what bothers me, because they're saying, hey, take this test, but if the test is negative, take another test. Are you trying to get me to be positive? Because, you know, there is something like a false positive and false negative, you know, meaning the one in like a whatever very low number chance that I could be, you know, wrong. Well, guess what? If you keep taking it over and over and over, well, at some point you're going to get that wrong number. And then there's going to be a whole lot of ramifications. Harry was sick. If he went on the first test, then they would say, no, it wasn't COVID. Maybe it was this, maybe it was that. I don't know. Nobody's checking him, right? But now, guess what? He's sick, and one of the 3, 4, 5 tests came back positive. Now all of a sudden, oh, no, it's COVID. Okay. So if it's COVID, now you got a man who has to stay out of work, risk losing his job, not making the money, stay home and pretty much infect like what everyone else's kids and stuff like that. And then at the same time, that has a burden on the people who work, right? People who now they're working somehow have to find a way to pick up the slack. And if we're talking about not his job, but other like mom and pops, now you got restaurants that are dying. You got places that are shutting down. To what? Stimulate an economy based on a strong possibility of a definite maybe I'm right? Is that worth it to you, man? All I'm saying is that the information is not there to justify some of the things we're doing. I don't mind if everybody get vaccine if the science was strong enough and if that common sense thing was actually common. It actually like, you know, kicked in at some point, right? Okay. First it was China, then it's not China. Then we believe they did make it, but then they didn't. Then China said, oh yeah, out of all of our people, like there was only 87,000 cases and like what, 40,000 of them like died or I don't know, whatever the numbers were, it was something like that, but it came out to less than 5% chance of dying if you even got it. Well, you know, I don't know. Hong Kong and some parts of China, there's 1 billion people, and you're telling me 87,000 got infected? I'm supposed to be afraid? Really? No. Okay, so fine. Billions of people, 80-something. Do the math. It's 5% of them, you know, died. Well, guess what? That's the other way. Flip the same sentence otherwise, right around. Well, billions of people, but only a few thousand people got it. Out of those few thousand, you have a 95% chance of walking away with no problem. That's the same narrative, the same numbers, just said differently. And that's my problem. If you say the same thing differently, you can scare the bejesus out of people such that they're going to make policies and procedures that have a whole lot of ramifications that nobody's paying attention to.
Okay.
It's a whole lot more serious than, you know, potentially throwing some genes in my body that alters all my cells until I try to kill myself or that you kill me down the road. Now, I'm not all about these conspiracy theories that you've probably heard, Daryl. You got to tell me some of the stuff you heard. But it's just got to make, if it don't make sense, don't do it.
Got glass and
what do you hear, Daryl? Some people tell me.
Well, I did hear that. There was,
what was it?
I've heard that, you know, some of the vaccines had you know things in it such as glass and other things, and I've heard all kinds of stuff. I've heard people say that, you know, by drinking alcohol reduces your chances of catching COVID. You know, you got some people that drinking. Some people believe that drinking alcohol reduces your chances.
So let me go get in there and get that Moscato.
Yeah, so if I'm drinking some Tito's or something like that, I won't catch it. I mean, at the end of the day, that's what people are saying. Like, people are coming up with all kinds of stuff, man. I've had
your president said drink bleach, right? Your president told you to drink bleach.
He did say
Someone else said drink your own urine.
Yeah, I saw that.
I just heard that.
That was something I just seen that recently. But people, you know, come up with different things. They were saying people were, you know, having hallucinations. They took the vaccine and went into the kitchen and saw like an elephant in their kitchen. Like, I've heard all kinds of craziness going on. So, I mean, you have that stuff that's out there. I mean, people, you know, have their own reasons and they come up with these things to say, and I don't know if it's to kind of put out there to put fear into people, or they just want to, you know, just cause an uproar. But you have all kinds of people have all kinds of beliefs, man. And and they go on the internet and they find different things and they tell people, they spread, the gossip, and people are confused. And then when you have someone from the CDC or a representative, from the science community or science and medical community, when they start talking and they're unclear, people don't really know what to believe. So when you add all of the Betty Crocker stuff that's being mixed up, I mean, basically, you know what I'm saying? I mean, it is what it is. People are scared, so they really don't know what to do. So when you see people and they're expressing themselves and they're saying, I shouldn't be mandated to take something. I mean, the guy that was on, he was on like the airlines, and he wasn't wearing a mask, but he put a thong on his face and said that was a mask. Like, I mean, he argued with them. He was like, well, this is what I want to wear.
Well, it is a mask.
I mean,
I mean, think about
look at it. I mean, but that's what people are doing. And when you have all these airlines, all these fights, unruly passengers, I mean, you really don't know what people, are going through. So, they're on this, right now mentally, they're all over the place. They don't know what to believe, what not to believe, and again, they don't want the government telling them anything. Anything
So
with
think
the
about what
government
you just
behind it,
said.
they think is a lie.
I don't believe in that. I believe the government, I'm not going to say the government has your back or not. I think for this particular epidemic, the government doesn't need to be in it, right? Think about it. Every other thing, West Nile virus, bubonic plague, anything, SARS, any of those things, had real medical professionals out there on the front lines telling you science, this is what's going on, this is how we're treating it, et cetera, et cetera. Have you heard any of that? No. You're hearing, well, maybe it's this, possibly that, and a strong possibility of definite maybe is this. Here's the thing. In medicine, we only have 3 rules, right? Because medicine, all we do is help people feel better and live longer, right? We have 3 rules. If what you're doing is working, continue it. What you're doing is not working, stop it. But if you don't know what you're doing, do nothing at all, right? Think about this. If your question earlier, why is the government pushing all this kind of stuff? Think about it. There's only 3 things that people do if they want the masses to move. It's fear. You scare the heck out of them. Yeah, I can do that through media and propaganda and all the rest of that. Force. I'll tell you what you're going to do, how you're going to do it, when you're going to do it. But I'll just wave this flag and say that you're free to do whatever you want in the country as long as you do what I say. Or shame. If you're not wearing your mask, oh my gosh, you shouldn't be walking out. You're trying to kill people. Think about it like this way. If Corona is so bad that you need to wear your mask to protect the most vulnerable of us, right? The ones who are likely to die if they get COVID. And people used to say, oh, well, that's our great grandma, Becky Sue, right? So you want to wear your mask and protect her, correct? And if we all learned that, just not a science question, commonsensically, who do you think is more likely to have a good immune system? Someone who's been here for years, or someone who's still trying to develop an immune system like a kid, right?
Okay.
If that's the case, someone who's been here for years and seen a lot of viruses over their life, 50 million versions of the flu, right? Because that mutates all the time, right? Compared to a kid who should be susceptible, why are you telling me that 0.000% of the American population will die from COVID and 99% of those are all adults? Why wouldn't kids die from it, right? Kids are almost 20% of all COVID infections, right? According to like Journal of Pediatrics, this is like a few months back, like summer or something like that. And I wish people would read this kind of stuff before they get around talking and spreading all the rest of this crap, because that's why we're up here right now. But they said it was something like 20% of all COVID infections. So at the time, it was like over 4 million cases, something weird like that, of kids being infected with COVID. Guess how many died? 300. 300, less than, by now, it's gone up. It's probably 400 and something now. 100 of millions. How afraid are you? It's a pandemic because the virus is on every continent. But dude, let's put the numbers in perspective. And now everybody wants to talk about, oh, well, what do we do? Because everybody's afraid because they heard about so-and-so who was intubated because of COVID. Am I right? You guys have heard about that, right? It's very scary, right?
Yeah.
Oh my gosh, they got COVID and they're intubated. How about the people who got the flu and they were intubated? Was anybody afraid? How about Epstein-Barr virus? Everybody was echovirus, adenovirus. Anybody afraid of those? What about the true pneumonia? Since COVID started, has anyone ever come in with bacterial pneumonia?
Well, they've been
Right?
treating
They used to be
COVID.
one of the top
They
killers.
don't talk about that no more, right? I mean, they really don't talk
Everything
about
is under
anything like
umbrella.
that. I mean, the beds are taken up by COVID patients, so they're telling people now, if you don't have COVID, to basically to like stay at home and wait, like, because they don't have beds. They don't have bed. They're treating people with the virus, and they really can't treat other people. Like, there's been people who are had surgeries being delayed and put off and rescheduled because they don't have units to house these people. You know what I'm saying? So it's like,
Listen,
so
what you
right now
got
it
is
seems like we're in such a huge crisis that we're not able to to handle what's walking in the door. So if what you're saying is that are they checking these people for other other diseases? I'm not sure if they're doing that, because once they come in, they test positive, they take that and run with it. That's it.
well. Let me interject a couple of things here. We're talking about COVID hospitalizations. Before I get into that and how wrong and how misconstrued that message is, let's think about this. A few months back in August, your president said that almost 90% of eligible Americans to be vaccinated were vaccinated, correct? That's 2 years into the disease, correct? So the number of people who are there, 90% of those guys were already vaccinated. That leaves a few people, not that many people who are not vaccinated. That was the vaccination was supposed to cut down hospitalizations. People are like, oh my gosh, why am I hospitalized? I got vaccinated. Okay, great. So if you had this many people for 2 years and they cut it down to this many because of vaccination, and the vaccine is supposed to prevent you from the hospital, why are we now saying we have record numbers of people in the hospital? Anybody do the math on that? How are you going to get record numbers, meaning more people now than you did in the past 2 years with no vaccine? Huh? I'll tell you how. People who are going to the hospital, and a lot of them are saying, oh my gosh, they're hospitalized with COVID. It really is that. Words matter. Hospitalized with COVID, not hospitalized by COVID. Right, words matter. A lot of people are going in and they're testing positive because they broke their knee. Heart failure, by the way, is still the number one reason for admission in America. Number one reason for admission to the hospital. Guess what? The number one killer in America still is heart disease. Number two is still stroke. You can go down and down. Number 7 is diabetes. Well, guess what? Nobody goes in with a diabetic coma. Heart failure patients, what? Hospital? No, they don't go in a hospital because it's just all full of COVID. It's not full of COVID beds. You got to remember what hospitals did, because I was there. They modified a lot of their wings such that to isolate COVID, they put isolated beds for COVID beds. Well, say you have 20 something beds in a unit, and now all of a sudden you have 5 isolated for COVID, and I get, patient number 6 with COVID. Oh my gosh, I can't put them in there. Oh my gosh, there's no place to put them in the hospital. The hospital's overflowing. We have no place to put a COVID. That's true. You have no place to put a COVID patient. Doesn't mean your hospital's full. Think about it. If I'm a hospital and you're sick, do I want you to stay out or do I want you in the hospital? Only one way am I going to get paid.
Okay.
Think about it. I'm just saying, again, nothing I said was scientific. Just common sense things. Number one, the numbers don't match up.
Let me interject right quick. So if people are in there and you're saying they isolate a certain amount of beds for COVID patients, if they're in there because they have COVID, right? Why can't you just keep all of them in one unit and not just take away 15 beds, but keep the same 20? I mean, because if they already got infected with COVID, right? What's going to change for them?
Because most people are there without COVID. There are a lot of people there with heart failure who actually have heart failure. You don't want them sitting in a bed next to a COVID or a room next to a COVID patient, right? So when I was growing up, you used to put 2 people in the same room. Now everybody has the same room, their own room, and it's fine. But that means that there's less space for multiple beds, right? So now your beds are lower. You isolate the COVID people in their area. The number one cause of admission is still heart failure. So they still got to take up all those heart failure beds. What are you gonna do? Right? So in other words, I can tell you another case, a case that I actually dealt with COVID. This was probably April or so, 2020. All right, had a guy come in, right? You know, chest pain. He was a handball champion, so very fit, although he's something years old. He came in off the plane after winning the handball championship. He said, "Oh, I got a little cough, and I'm a little short of breath." So guess what? You got COVID until proven otherwise. So he came in, tested him, COVID test, absolutely negative. We brought him to the cardiac suite, the heart, catheterization lab where we look inside your arteries, make sure you're fine. Fine. He was there. He was happy. Came out, did another COVID test because they said, well, we don't believe the first one because he was short of breath and had a cough. Like there's no one else in the world who ever had a cough or short of breath until COVID came out. So anyway, he came back and the test came back positive for coronavirus NL65. Everybody's like, well, what is that? That's not COVID-19. I don't know what is that? Yeah, I don't know, but he has coronavirus. So I was consulting on the case. They said, Dave, what do you want to do? I sent him out to another hospital because we didn't have enough resources where we were. I wanted him to get a cardiac MRI so I can look at what's going on around the heart. Totally independent of COVID. I read the case though. Turns out he went to the other hospital. Those doctors did not believe he didn't have COVID because his heart was fine. And so they did another test, which I read also came back negative, but they said it's probably a false negative, and we're going to say he has COVID. Because he clinically has COVID. All right, back up. This guy, very fit, no problem, came in with 3 negative tests, but they said, I think he has COVID. So what gets written on his diagnosis? COVID.
Okay.
Right? Think about it like this. A lot of other people, this is a total other issue that really bothers a lot of us in medicine. I'm a cardiologist. I have patients who have heart failure, heart disease, people who need to see me when they need to see me. They fill up with fluid, they drown in their blood, they get really short of breath. People like that who come in short of breath with people and providers with a low threshold to call anything COVID, whether it's positive or not. Those heart failure patients can get diagnosed with COVID. If the heart failure patient can get diagnosed with COVID, do you think they want to come to the hospital? Heck no. Especially knowing that if they got COVID, no matter what, it's going to be infinitely harder for them just to breathe, right? So here's the thing. If you have heart failure, #1 killer in America, and you're scared to come to the hospital because you're scared you may get COVID and you stay home, what do you think is going to happen to you? You're going to live? You're going to be healthy? You're going to be self-sufficient? No. These people decline. We had a lot of people during this COVID outbreak that died, not from COVID, but they died because they were afraid of getting COVID. Okay. And they wouldn't come to the hospitals. Anybody talking about that? Let's talk about the number of people who died out of fear of COVID and compare that to the number of people who actually have COVID, and then compare that to the number of people who have COVID that actually made them sick, and then compare that to the number of people who got COVID and made them sick and actually was the cause of their death. Okay. Bruh. Again, just give the information, let people choose. You may still choose a vaccine. There's no problem with that. But to create fear for you to do it, to shame you to doing the vaccine, and then to force you to do the vaccine, unacceptable. Okay.
All right, man. So, I mean, what do you feel about that, man? I mean, what's your opinion on what Dr. Smith is saying?
Well,
just say I'm right.
I mean, it just seemed like just sitting here talking and listening.
Because this is truly a lesson. I mean,
everybody that's what I'm saying. That's what I'm
watches
saying.
This
so
will
I mean,
like get a lesson.
It's like you can't get this kind of knowledge. Not unless people are like, it's like you want to let people. It's like, Daryl, man, you need to let other people in on this podcast because they need to hear this kind of stuff.
Correct. And that's
my thing. I just want people to prove to me. I mean, tell me. Don't feed me doo-doo and tell me it's a burger. You know what I'm saying? I'm not. Like, don't shoot a squirrel in your bag, make it up, grind it up, and give it to me and say it's a hamburger. It's a squirrel burger. There's a big difference.
So now I just got, because I was just looking at at the job, I had to let them know, like, well, the protocol for them for the city. In order to come back, you got to be cleared by the doctor, yada yada. They have us give documentation that when you're cleared to come back. In the meantime, you just gotta have it checked out again. So
Right.
that means I gotta probably do another test. It just seemed like
That's what got you in trouble in the first
it's a
place.
revolving door, man. It just seemed like a revolving door right now.
Mhm.
Hey, now I'm gonna go off the mark. I'm gonna say some controversial stuff, and I don't know, y'all might get mad. I don't know if I believe it. I'm still formulating my thoughts on this, but like I told Harry before, COVID ain't gonna go away for a while because too many people are making too much money on it. People got to make money on the masks. Some people like loaning out money, small businesses that, they're making a whole lot of money on interest, right? Some people make a lot of money on you coming to the clinic and then going back. You think CVS and Walgreens and Walmart are mad that you're coming in there to get tested and then you got to sit there and just look at all these things that, oh, wow, by the way, you're going to buy. You think they're mad that you're coming in to see a nurse practitioner or a PA who's now going to get paid more because they're doing these tests? You think one of the, I'm not going to mention the name, but one of the newer clinics that really just focused on giving out vaccines, now you think they're mad that they're on the news every morning at 7 o'clock? Heck no. This is free publicity, free advertising. You think they ain't making money? Controversial, but we can have that discussion. I'm just saying things are a little bit too fishy. And yes, to your point earlier, Harry, you were talking about how fishy this was. Yeah, all of a sudden we thought China was coming out trying to kill people because Trump went over there and they were arguing about some crap. And then all of a sudden, COVID comes out. And while we're all fighting over like Trump's last thing, I don't know whether it was a girl or whatever, and COVID and this and that, did anybody pay attention to right then China sent up multiple satellites way up in space, satellites that we don't know what they do and what they can do or you can't do. I know satellites are powerful because back in 95, I spent some time in Germany. I was hanging out with my sister who knows a general. 95, they were telling us about a satellite way up in space that had such resolution. They could read the date on a dime in your basement. What kind of satellites do you think we got nowadays? But everybody was so focused on coronavirus, they had no clue what was going on.
Right?
That was 95. Here's the thing. It's easy to move the masses if you keep them confused, right? To your point, Harry, we came out, Stedman, when he was with Oprah, had to, spend 2 weeks in isolation. And then all of a sudden, it's not 2 weeks, maybe it's 10 days. And then now we came down to 6 days because whoever runs Delta ended up calling and asking the CDC, can we just isolate for 6 days? And NBA wants to do, maybe it's 5 days or maybe it's longer, but I don't know. And then it's like, well, you should test yourself early. If you test yourself early, too early, you're not going to get a positive. So you should test it early in the disease, but not too early when you're actually sick. But now when you're done and the disease is over because it's been 5-6 days and you feel fine, maybe we should test you again. And if it's positive, then we'll start the whole process over again. But you don't have to test again if you don't want to. What? This whole thing is so confusing that just by me saying the last 30 seconds alone should make people mad enough to say, I'm not going to do this vaccine till you get your stuff. I'm going to say stuff. I don't know what kind of podcast is it. Get your stuff straight before you start telling me to put stuff in my body that you have no clue what it is. You don't know what this stuff is. You don't know what it does. You're just guessing based on what? Fluff? You have no data. Don't tell me to put this stuff in my body unless you give me sound data. That's all I'm saying. I'll tell any